Hello, everybody. Hello, everyone, and welcome to our webinar, Review of New Cleaning and Disinfection Requirements. This is a webinar for facility managers and property owners. My name is Steve Kelts, and I'm the Director of Communications at Rail Facility Solutions. I just want to thank everybody for joining us today. And if you have any trouble hearing me, please feel free to type in a chat and we will continue. I'm also going to go over our agenda today with just a couple of housekeeping items. As many of you already have done this many times, just want you to know that you will be getting a recording and or slides of this presentation emailed after the webinar. You've also all joined this webinar in listen only mode, which means you are on mute. So if you're shouting at me and I don't respond, that's probably why. Thirdly, there will be a Q&A at the end of each section. So we are going to basically ask you to send us your questions in chat at the end, and we'll try to address them all. The key topics we'll be covering today are a few things, 4 things basically. There are new rules regarding janitorial compliance and disinfection and cleaning, and we'll do a review of what those are and what those mean to you and your building, as I'm expecting many of you are facility managers and property managers on this call. Actually, I will do a quick poll and ask how many of you are responsible for implementing COVID-19 response plan. So feel free to answer that. As that will be relevant to what we're doing today. Okay. All right, so it looks like more than half of you are responsible, so that's good news. Okay, terrific. So as I said, we will be covering some of the new rules. We'll also be covering some of the protocols that are out there, and you've heard a lot about protocols and guidelines, and we'll discuss what those are. And there's some new ones that are very interesting. There's new stars, which I'm mentioning, which are some interesting things that are happening in the facility space that you're going to start to see more and more about in the news. And then new considerations really talks about things to really think about when we're getting into the disinfecting of facilities. I know everyone's scrambling now to do disinfection, and in addition to their cleaning and janitorial. And I think it's important that we review a lot of what you should know when you're spraying things in your facilities. All right, let's move forward. We're going to have 3 distinguished panelists today, which I'm excited to introduce to you. The 3 are Dr. Gavin McGregor Skinner, who is the director of the Global Biorisk Advisory Council, GBAC, which you'll learn more about as we go. He will be followed by Branton Sero, who is the director of training, education, certifications, and standards for ISSA, which is an international cleaning organization. And thirdly, we will have Terry Cotton, who's the CEO of a company called Epic Biosolutions, who will talk to us about the importance of using the right chemicals in disinfecting and what the considerations are when choosing a company and chemicals to do that. So let's get into it. So obviously the current situation has changed for all of us, and facilities management is now a matter of health and safety. Whereas in the past we were cleaning for aesthetics, now it's no longer doing janitorial services for cleaning and aesthetics, it's really for health and safety. So what's on top of that is property owners and facility managers are facing unprecedented compliance challenges. What does that mean? There are new rules, and as you're well aware, every day there are things in the news, and states and municipalities are now coming out with new guidelines. But the new news is that they are now mandating that janitorial services adhere to stricter guidelines. And those guidelines that they're referring to often include the CDC, the World Health Organization, and the Global Biorisk Advisory Council, which the third one you might not know as much about, but it's important to know that name because it's becoming very much the new standard in this country. So some of the research that we're finding regarding these new rules is that, like I said, janitorial, used to encompass cleaning, but now disinfection is required. And these numbers will change surely, but right now we're looking at 26 states that include in their rules that they must conduct regular cleaning and disinfection at least after every shift, daily or more frequently. That is a lot of cleaning and disinfecting, and as you can see, we expect that number to grow. So there's a new level of service that needs to be applied in your building, and it's only moving forward is only going to add more and more states to that. Another feature of these mandates and requirements are logbooks. Now, logbooks used to be a good idea, and people used to have them maybe as notebooks or pieces of paper on site, but now these are required. And right now, 15 states are mandating that you have logs on site that include the date, the time, and the scope of cleaning that you're performing. That kind of dovetails a little bit into the notion of having a plan, and some states are requiring a full-on plan, and we'll talk about that a little bit. This now only 13, but I think it's growing as well. 13 states also must develop COVID-19 prevention plans prior to opening. So those plans are also going to have to be on site. And what we've noticed in the language here is that if you look at the lower right corner of my screen, in New York, for instance, they're indicating that while these are not necessarily need to be submitted, they need to be on hand in the event of an inspection. So what we're understanding is that New York and others are gearing up to start regulating. Right now, we're in the early stages. They're getting stricter as the situation worsens in some cases. The rules are getting tighter, and the regulation is soon to follow. So what does all that mean? It means a couple of things, and there's a lot of concern in the industry now. Obviously, litigation may be looming. There's a new factor that, certainly the more contact tracing that goes on in the world, the more, there's an opportunity or a chance that contact tracing may lead back to your facility, which basically nobody wants. So that's another issue. So at the end of the day, the time is now to get on board with implementing not just a janitorial program, but a validated janitorial program that can not only limit your liability and mitigate risk, but also comply with these new rules. Another thing we're expecting is what we're calling a tenant and employee bill of rights. What's going to happen now is, in addition to states and municipalities requiring certain things, tenants themselves are going to start demanding certain things that they have in place before they come back. Obviously, buildings are putting together their reopen plans, and that's great. But we're also going to expect that expectations are going to be high from tenants on what they need to see is happening, and what are the optics around what's being done. Saying it's being done, or it really needs to be proven that it's done, and that's something we're going to talk about a little bit. So the new problems in all of this is that, as I said, there's not a lot of validation for these requirements. People are being required to disinfect now, but there's not really a lot of tools or guidance on how to comply with these guidelines. Regulation is imminent, inspections are imminent. There will be financial and operational penalties if we are not compliant. So what happens, and what's the problem now? How do we oversee these new programs, and how do we get them, to assure our public, our staff, our auditors that we are doing the right thing? The time is now to restore their confidence. So obviously you ask yourself, are you ready to reopen? And this is a question obviously is on everyone's mind. And when you're implementing some type of janitorial program, you obviously want to maintain confidence in your tenants. You want to deploy an effective solution, which means getting the job done with minimal damage to your premises. You want it to be affordable. Obviously, we talked about requirements being disinfecting daily, which in some cases we've heard as much as hourly in hotel environments, which is a lot of work and it's a lot to prove. So affordability is a big issue. Environmentally sound is another issue, because everyone is saying, okay, your chemicals need to be EPA approved, but there's a wide range of chemicals out there, and they're not all good for you or your building. So we'll talk about that in this presentation. Vendor qualifications, obviously, you're probably overwhelmed right now with people showing up and saying that they do disinfection, and disinfection is the new hot service to provide. So it's important to really understand, who's doing what, and what are they using. And thirdly, and most importantly, is compliance, and having, whatever you're doing needs to be compliant, or there will be repercussions, as we've said. So it's important to be aware of what those requirements are and to figure out how to comply with those requirements. So what the good news is, and this part I'll go quickly, and just to review some of the technologies out there. There are janitorial program technologies that you hopefully are using or are aware of, starting with these analysis tools like ATP monitoring. ATP monitoring is a tool that enables you to identify and score viral bacterial levels at certain touch points. So you can literally take a reading to see if you have bacteria at a high level or you have exposure on surfaces in your location. That's important to know, and obviously, the follow-up is to take care of it, and sanitization is obviously mandatory. So what's important, and you might have been aware of certain things like there are foggers and other types of technology out there. We think that electrostatic spraying is a very important technology to be aware of, because that is it adds electrical charge to the chemical and the solution that's being dispersed, and that coats the surfaces instantly, and it coats areas that you can't even see. So it's providing type of a wraparound coverage. And I think companies that are doing that are very important, and that is, especially in large spaces, that provides a very, very big exposure, a very big solution to coverage. Another thing I think is we're thinking very interesting is this validation. How are we validating that we're doing these cleaning and following and being compliant with the rules? And NFC tags are fast becoming very popular. You might have seen in the past barcodes, and we'll talk about that in a second. But NFC tags are a different technology. They're what you call near field communication technology. They're very small, and they come in many shapes and sizes. They are placed around areas that enable checkpoints, and I'll go into that into a second. What is NFC technology? Quickly, is basically the same technology as Apple Pay, Google Pay. It is contactless. You touch your phone next to a tag, and it displays information. But more importantly, it recognizes who's touching that tag, and it displays the information appropriate to the person and the role of the person touching the tag. As I mentioned, barcodes are something that's been done in the past for asset tagging, but from a compliance standpoint, barcodes are easily replicable. People take pictures of them, they print them out in books, and they scan a barcode and never actually go to the area. I'm not saying that anyone we know does that, but we've heard stories that they're not foolproof, and they are easily copied. So what's good about the NFC tag is that it is, as we said, it puts a date and time stamp on the activity, and it also renders information. So as you see here, this validates the time and date that services have been provided. It validates who provided the services. It also can display protocols and procedures. Obviously, as we become required to follow CDC and World Health and GBAC protocols, these tags can display those protocols. So there's no onus on the service or the facility having to remember or to double check that they're doing it. The tags themselves can hold that information and display it and provide checklists, so anyone providing services can comply and can confirm that they've done the work that they said they were going to do. These tags then also feed into, I skipped ahead. These tags live in your environment, and they provide optics to both the tenants and the service providers that are doing work in your building. Tenants can also access these tags, and indicate the last time services were performed, which is a very big confidence restorer, as you can imagine. So it works twofold. It provides service providers with guidance on what they need to do, but it also takes a record for both management and tenants and auditors who need to see that information. These tags feed into reporting. So in essence, you have a dashboard of what you have in your building and what's being done in your buildings at any given time. So it becomes very easy to manage these programs. And more importantly, these programs, there are things, as we've said earlier, logbooks are now required. So we believe that, the world is going digital, and certainly New York City and other departments of buildings are going digital. You may be aware of the New York Building One City initiative, which is an initiative to basically move all things construction and building to a digital platform. So we believe that these logbooks will become digital requirements that will need to be sent to the appropriate regulators and authorities having jurisdiction who need them. So having a digital program in place that's capturing what you're doing and being able to report it both in a dashboard to your management and in a digital logbook to those that are looking for compliance is very important. Lastly, I will, and you guys will get this presentation, but you obviously want to check your state's requirements, and there's links here for, it's a partial list of a bunch of states and what they're issuing. But I would say that almost we've gone through all of these, and this presentation is an overview of a summary of what that is. And I would say that logbooks and a plan, and in some cases even a dedicated officer to these programs are going to be mandated. So it's a good idea to get out in front of this. And at this point, I will pause for any questions as I'm going to switch to section 2, which we're talking to the GBAC, and why is that an important entity in this equation. Feel free to ask me any questions in chat at this point, and I'll try and address them. Otherwise, we can just move on. All right, so no questions at this point. I'll pass the mic over to you, GBAC.
All right, thank you so much. Well, good afternoon, everybody. My name is Branton Sarrow, and it looks like you have 2 Brants on your screen right now, but the other handsome man is Dr. Gavin McGregor Skinner, and I'll introduce him in just a moment. But I wanted to just first go into the next slide here and discuss really who is GBAC and who is ISSA. So the Global Biorisk Advisory Council has been around for several years and has been known over the years to provide really detailed, in-depth training and certification programs for disinfection, decontamination. Typically costs thousands of dollars. It took 2, 3, 4 days, maybe 5 days at times to get through the program. And you can go to the next slide as well. The model for GBAC is to prepare, respond, and recover. And back last fall, I think Gavin was roughly in the September, October timeframe, GBAC and ISSA formally came together to provide these services to the ISSA member base, which currently we reach over 9,500 company members. I know the slide says 9,300, but it has been increasing dramatically. And we're in 105 countries. So for us, it's very humbling. And GBAC itself has actually gone through and certified thousands of people over the years. You can go to the next slide, please. So we wanted to highlight quickly who some of these famous scientists and incredibly smart people are on our team. But GBAC is led by Miss Patricia Ollinger, goes by Patty. She is the GBAC Executive Director, formerly with Emory College or Emory University. We're going to talk to Dr. Gavin here in a moment, but we also have Paul Meacham and Stefan Wagner, along with dozens more of individuals that take part in the Advisory Council in the assessments of the GBAC STAR program. Go on to the next slide, please. So just a little background on Patty. Patty is part of the ISO Conveners Board for Biorisk Biohazard. She was actually one of the instrumental people when the Ebola outbreak took place and they had people come to Emory University in 2014. She's absolutely remarkable. And many of you will be able to have the opportunity to meet her in the coming months as you integrate with GBAC. Next slide, please. And this is where I get to pass the baton off a little bit to the other handsome Brant and Sarah on your screen, Dr. Gavin McGregor Skinner. Gavin, would you mind introducing yourself and telling us a little bit more about GBAC?
Yeah, thanks, Brant. Thanks, Steve. So I'm Gavin McGregor Skinner. So I work with Brant very closely as we try to help you through a partnership of actually going through the plethora of documents at the moment. Steve highlighted some really important websites that are out there at the moment, but what you don't see behind those websites is tons of stuff. It's tons of paperwork, and it's really confusing. So my background has been in infectious diseases now for over 25 years. I worked at the Center for Disease Control as an epidemic intelligence service officer, which is just a fancy name for a disease detective. So I went out and investigated those disease outbreaks that, the diseases like COVID-19 that have no vaccine and no cure. Next slide, please. So right now, the big question is that, in 2019, we cleaned. We cleaned because it looked good, it smelled good. Now we have to clean to make things safe. And the challenge we have with so many of the different sectors, facilities that we're working with is how do we determine what is safe? And what we see is a lot of organizations have spent tons of money on technology without actually starting back where they should be starting at a risk assessment. So the GBAC process is really to help you understand that, yeah, we're going to teach the world a 4-letter word. And that 4-letter word is risk, and how to use risk. And how to use risk not just once a month, once a year, but how to use it every day so that, again, it's cost effective, there's a return on investment, but you highlight the areas you need to clean and disinfect, that emphasis on disinfect, to break the cycle of transmission of a virus with no vaccine and no cure. And we do that through a partnership. So overall, our concerns right now and what we're hearing from all of our clients, our customers, our patrons, our guests is how do we know what we did in 2019 actually fits the risk, the threats that we're facing in 2020. Next slide, please. So the way we do this through the Global Biorisk Advisory Council through ISSA is to form a partnership. It's to form a partnership. The whole process that we're doing here is not a pass or a fail. It's not an exam. It's not a test. It's definitely not an audit. I don't do audits. Those other people do audits. I'm not part of that crew. What I do is we help the whole team, Brant and myself and others, help you through a partnership understand what you need to do. Just like Steve outlined, things have changed, but what have they changed to? Is it changed because we have to spend more money? No, it's not. It's a change to be more strategic. And as Steve highlighted, how to validate that strategy, how to show what we do works. How do we then ensure that our employees understand, as well as our patrons and guests understand, who is using our facility, that our facilities are safe. Next slide, please. And then we do that through, again, I'm going to emphasize, and I'll keep saying this process of risk, this understanding of what a risk assessment is, identify what the hazards are, and how to come up with mitigation. And that's ensuring that we use the proper standard operating procedures, our procedures, the training. I don't know whether you've looked at the OSHA federal government website lately, but it actually says, as America, as you reopen, all employees must be trained to be made aware of COVID-19. They don't tell you how to do it. They don't tell you what should be in the curriculum. So Brant and myself and others have sat down and we've worked it out. And that's why we've developed our online course. It takes about 2 hours, but when we spoke to OSHA, it meets that need. Even though they didn't define what the need was, it actually meets that need. We're going back to looking at what your equipment was in 2019 and how to apply the equipment you had in 2019 to a 2020 problem challenge, but without spending a lot of money, without having to say you've got to go and buy this. Looking at the tools, but also looking at the chemistry of the products that you use, the cleaning products, as well as the disinfection products. How do we ensure, and again, Steve outlined this very clearly, how do we ensure that what you're doing for your building, the facility, the people, your staff, employees, meet the needs, the requirements? And it would also emphasize, Steve highlighted the states what Brant and I are seeing, it's down to the cities. The cities are actually telling facilities, you must do this, not just the counties. So as we do this, and I like how Steve's done this really nice deep dive into the states, but we've got to go even deeper and look at what the counties are requiring, or even the cities themselves are requiring. Next slide, please. So who's this for? Well, actually at the moment, to kill the virus, to inactivate the virus, to break the cycle of transmission, it's everyone's responsibility. And I commonly get this question every day: who's responsible for this? Well, it's everyone. What we do at home, where I live, what we do where we work, how do we get to work, how do we travel? So again, the work that Brant and I do every day is talking from anywhere from a convention center that has 2 million square feet all the way down to a hair salon, to a spa, to a restaurant, you name it, we've covered it. Hotels. Again, you may have seen the recent announcements. American Airlines has signed on, Hyatt Hotel has signed on, Miami Dolphins with their arena has signed on, but we've got convention centers now across the country. And what we're seeing as they go through this process, they're going, hang on, if I hold an event in my convention center for 2,000 people, where do those 2,000 people go after they leave my building? They go to hotels, restaurants, and they use transport. Are they involved in the system? No, not yet. But taking all that stakeholders, that whole community approach, when we look at through a lens of risk, and how does the GBAC team through ISSA, how do we help mitigate those risks? Next slide, please. So the hardest thing when we talk about anything that's new, anything that may help is, well, gosh, it's too hard for me. Where do I start? Well, we've actually designed an accreditation handbook. If you decide, and again, the whole team is here to answer any questions, to elaborate on information that you may need. What are we seeing right now? Well, the facilities that are going through this process, and it's a 6-step process, they're taking about 2 weeks. It's not a paper-based exercise. Although we do accredit you and we look at based on the documents, we do have conversations with you about those documents, looking at the how. How do things work? Again, you apply through the ISSA GBAC site. You submit applications, you get engaged with a GBAC member who will help you facilitate. It's a 20-element process. And as we look at those 20 elements, I think Steve highlighted this really important. Documentation is actually our element 20. Element 20 is documentation. It's going to be really hard. It's going to be really hard for us to store securely and safely the documentation to show that we actually did proper cleaning and disinfection. We trained our employees. We gave them the right personal protective equipment, whether it be gloves, eye protection, had a face coverings for nose and mouth, but also did we actually read the labels of the disinfectants and follow the directions properly? All that has to be documented right now. I think Steve gave a really good example of how to do that electronically. Not everyone has that, and I think it's something we need to look at, because I think it's a great idea. Next slide, please. So again, we talked about the steps. Where do I start? Again, what we've done, Brant and the team and myself have done on our website, our GBAC website, we actually have it's a readiness assessment. It's like a checklist. It'll help you identify what you already have, which you don't need to change. It'll help you identify some needs and gaps, but it'll also help you where to start on as you start to put that documentation together. You complete the documentation, you upload it. But even during that process, we're actively engaged, with members of the GBAC team to help you facilitate the process. And again, I want to emphasize that most facilities now, whether it be a restaurant, a hair salon, a spa, a gymnasium, or a convention center that's got 2 million square feet, they're taking about 2 weeks to get through the documentation. It then takes about another week for the GBAC team to review that documentation, all 20 elements. And then again, what does it mean when you get the GBAC Star accreditation? Well, next slide, please. Well, it doesn't just end there. So based on the ready assessment that you've taken, this is about continuous performance. Steve highlighted about we're moving into a paradigm now. We're moving into an environment where we're focusing on performance-based. What does performance, clean and safety look like? So based on your readiness assessment, as you form a relationship with the ISSA team, the GBAC team, we actually are there to help you say, well, once you get accredited, it doesn't stop there. It's about continuous improvement, and how do we help provide some feedback through our subject matter experts to ensure that you maintain the levels, the standards that Steve outlined, as well as continuous improvement in combating clean and disinfection, but also decreasing the viral load or inactivating or killing a virus. Next slide, please. The application, again, is all online, very self-explanatory. Screenshots of what that application looks like is here. Again, if you have any problems, we're always very ready to and open to discuss those challenges you might have and to help you facilitate that application process. Next slide, please. So following the application submission, step one, we have subject matter experts on the ISSA team that reviews the recommendations. They may come back with you. They ask for clarification. I'll give you a real world example. Last week, a convention center submitted all their documentation, and I looked at their protocols, their procedures, their standard operating procedures, and there was two. I think they sent me about 15, and 2 out of the 15, I just couldn't, for the life of me, work out what they were doing. So we got on a conference call and I said, just use the video, show me what you're trying to say. And they said, we do this. And so through a simulation, it was a walkthrough. We did a walkthrough using video. We watched what they did. They identified their high touch points and said, now I've got it. Good, that's it. That's exactly what I want to see. It just didn't look right on the paper, but seeing it visually, it really helped. You'll get the handbook. You'll get, again, a lot of other resources that we provide. We have an online, again, our online fundamentals course, our GBAC online fundamentals course, which meets the OSHA standards requirements. But even when you've received the accreditation, again, I want to emphasize we are still part of a team, a partnership. Again, we're not sure what this virus is going to do. We're not sure whether other bacteria or viral diseases are going to appear. We're not sure what this is going to do as we come closer to flu season, or we start to open up and we start to see more crowding and that less physical distance. So we're here to help solve some of those challenges and problems that you might be facing. Next slide, please. So again, very clear, final stages, we talk about one, performance-based, we talk about continuous improvement, we talk about, more importantly though, how to implement a risk assessment process that's always on, that's always there. And again, risk does change throughout different events, different times of the day, and then how do we mitigate those risks? And how do we ensure that as we work together, that we, again, as Steve really outlined very clearly, that we're in compliance with whatever regulations that we need to follow. Next slide, please. Over to you, Brant. The other Brant.
Yeah, Kevin. So, ladies and gentlemen on the call, this right here is talking a little bit about what's included in the GBAC STAR program. So the very first thing in the gray area is every single physical property will become a member of ISSA. Based on the type of membership, I mean, that value right there is thousands of dollars. And then we also baked into this is the online fundamentals course that Gavin mentioned. And depending on what type of facility you are, and I think everybody on this call is generally a property manager or building owner, you will actually receive one online course per $1,000 of spend. So what that means is inside of your building, you want to have somebody that's at a lead, a supervisor position, take that course so they can disseminate that out throughout the rest of the staff. Next slide, please. So I wanted to quickly highlight a couple of stats that I've seen recently in some articles. And if you think about how the industry has shifted, what we're noticing is that so many people work from home, but roughly 70% of those people, they don't want to go back to their office space. They're actually finding it safer to be home. They're able to be more efficient working from home. So the things that we need to start figuring out now are how do we get people wanting to come back into our office spaces, our office suites, and the multi-tenant facilities. And I think a lot of this has to come back to validation, it's adhering to processes and protocols, but more importantly, how do we communicate that back to the end users or your consumers and your tenants? Because at the end of the day, they need to know exactly what you are doing. And I've said this on numerous webinars over the last few weeks, and I know Gavin can attest to this from being out in the field, but so many people now are well aware of what does it mean to clean, what does it mean to disinfect, and they're watching every single move you make. So it's absolutely critical in my mind, Gavin, is that individuals need to be trained. They need to have certificate of completion or some way to validate that they've been trained, but also, again, communicate, whether it's through a tagging system or some sort of communication plan on what this means. And you look at the big brands, you look at the American Airlines, the Hyatt Hotels, the NFL, or any other groups, that's how they're telling their story. They're talking about what they were before, what it means to become GBAC Star, and what are they going to do after.
Great. Thank you, Brant. Thank you, Dr. McGregor Skinner. At this point, we can turn things over to Mr. Terry Cotton. Are you ready?
Yes. Okay, thank you, Steve, and thank you, Gavin, Dr. McGregor Skinner, and Brant for sharing that information. Actually, it's very useful, and it's interesting because people really are looking for order right now. They're looking to feel safe. We're looking to restore confidence in the American people in the world, and there's a coming together and formation of structure, and that's in the form of protocols at the federal, state, local, and industry levels. And it's wonderful what you're doing over at GBAC. I applaud the efforts there. We at Epic Biosolutions are a provider of product and process solutions to provide solutions for protecting and disinfecting and protecting spaces where people live and work. And our goal is a focus on personal health and safety, and that means products, that means processes. So there are a lot of ways to kill germs, and Dr. McGregor, I guess you can agree with that. You have a long background in that. But now that we've been focused in panic mode for the past few months, people have been essentially bunkered up in their places. They want to get back out. We're talking about reinstating confidence, and confidence in that the place you're going to is safe. The focus in products has really been on killing COVID. Does it kill COVID? And there have been tons and tons of disinfectants out there. There have been lots of products and chemicals that have been used. And frankly, there are a lot of ways to kill germs. There are a lot of chemicals to kill germs, and they're everything from UV lights down to a plethora of chemicals, right down to vinegar. And if now that we're sort of getting out of the panic mode and just focused on killing COVID, which we're talking about restoring confidence in public health and safety, but we're also starting to think about our own health. What kind of impact are the things that we're doing, these products and processes, having on people and surfaces? And that includes us, our pets, in our homes, in our offices. It's great. It comes in, it's disinfected, it's clean. But is there going to be a short-term and a long-term impact on my health? And people want to know that. So, taking that into consideration, and when we were faced with this crisis as well in the pandemic over at Epic Biosolutions, we took those questions into consideration. And so in creating a program, and we're focused on the application and the products in order to achieve the goals of making people feel safe. So we do disinfectants, we do protectants, and we have crews that apply those disinfectant and protectants. But if you were the scientist that wanted to create a perfect scenario for making people feel now safe in the long term, that the stuff that's being applied to kill germs in the places they are occupying, how would you build that perfect product setup? How would you attack those germs? How would you attack COVID and everything else that could be considered dangerous? And that's what we're really fighting here. We're trying to make people feel safe. And what does it mean? There are a few things that you would take into consideration if you were to build the perfect solution. And next slide, please, Steve. So, these are simple, but I could talk forever, but I won't. You want it to be safe for people out of the gate. And we specifically chose active ingredients that are safe for people. And I'm going to keep this agnostic and academic. You would want a product and chemicals that are low odor, that are non-toxic. that are safe for surfaces, that don't bleach surfaces, that you can apply them both on hard surfaces and soft surfaces without damage to fabrics. You have curtains behind you, Brant. What are you going to spray on your desk? What are you going to spray on your desk and rub in? What are you going to put on that curtain? Is it a different product? If you can get it all in one, it's the way to go. You want them to be versatile. You want to be able to do both hard and soft surfaces. And when I talk about non-toxic, I'm going to mention a chemical name. And listen, chlorine dioxide has been around for a couple hundred years. Our active ingredient in our disinfectant is based on a stabilized aqueous solution of chlorine dioxide that is in its state, in its ready-to-use formulation, is safe for people and it's safe for surfaces. And what it is, it's a gas that will help to kill germs in the air and on surfaces. So that's how we put it together. And there are a lot of ways to skin a cat, but that's how we started to put that together. Next slide, please, Steve. You want your process of disinfection and protection to be effective. Not only surfaces, but if you can get the air, you'd build it that way. And listen, microbes and pathogens, you don't want to create superbugs. There are chemicals that actually allow for superbugs to proliferate, and these pathogens will adapt to these chemicals, and we could be creating and building in a problem with the wrong type of chemicals. They should be fast. You don't want to sit around soaking surfaces and waiting forever for your product to go to work and your space to be disinfected. And as well, the application of spray application makes for things to be much faster. Steve, you mentioned electrostatic spraying earlier. Electrostatic spraying is one way to achieve that. You don't want them to be invasive. I mean, as much as we are, and I won't mention brand names, but some chemicals could be, people could be very sensitive to the odors. And that's very often the case. You want to use a low odor formulation if possible. And, and that's really the best way to design a product that's going to disinfect a surface and not leave a residue on the surface as well, because residues on surfaces can have long-term effects. And there are a lot of studies that support the fact that some of these chemicals that are being applied to surfaces, actually are active for longer periods of time, and their toxicity actually lasts. Economically feasible. We've got a long-term protection program that offers not only initial disinfection, but it offers a protection, which is a long-term antimicrobial protection, which will help to alleviate the opportunity for pathogens to proliferate on a surface. Next slide, please, Steve. Next slide, please, Steve.
Sorry, that was the last slide.
Okay. So when you put that all together and how to build, this is where the discussion has moved. The discussion has moved away from just killing COVID, and it's moved into how do we become more efficient and effective to achieve economies of scale around feeling safe. And it's organizations, it's a process, and it's organizations like GBAC who are actually monitoring and building awareness around standards and methods and means and practices, and creating all the things that I mentioned, using products that actually are safe, because the next wave, and I'm sure you'll jump into it, I've seen the presentation, Steve, are things like legal considerations, litigation, things that always come up whenever there are chemicals involved. So the goal is to try to use the safest, most efficacious solution possible for mitigation and protecting human health and safety.
Terrific.
So yep. Any questions?
I'll ask a question as well to the group. And again, thank you so much, Terry. That was awesome. And it's, again, it should be something that people really should be thinking twice about. And it's not, we're all so focused on just getting disinfection happening because we're told we have to. But you really got to take a step back and make sure that you're doing it in an effective way and in a safe way. And chemistry has a lot to do with that. So I really appreciate your time and thoughts on that. I'm going to ask the audience in the final minutes if there's just, if you'd like us to follow up with you, if you'd like any of us to follow up with you, as I've said, you're going to get copies of this presentation emailed to you, and contact information is in that. So I look forward to doing this again. Thank you again, everyone, for taking your time on this important subject. We feel we try to cover a wide range of stuff that's going on right now and hopefully make sense of the madness that's happening. But I think that the good news is there are real tools out there that are going to help people comply with these rules and regulations and these mandates. There's technology, there's protocols, there's chemistry, and in combination, we can get through this in a safe way for our people on our premises. So again, thank you all for attending. I'm going to close it now, and we look forward to seeing you on the next one.